concept of better with age. My oldest client that I work with currently is 86. I have several cases of guys, in their 70s that are better than they were in their 60s or their 50s. I mean, so many times you just hear the excuse like, oh, I'm 10 years older, not like just throwing in the towel. And I think whether it's the Neubie or any of this stuff, like there's so much capability to get better.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation. Welcome to the Undercurrent podcast. My guest today is Jared Bickle, physical therapist in Fort Wayne, Indiana. And he has a really cool practice that we'll get to talk about today with a very particular specialization in rotational athletes, working a lot with baseball players and golfers. And his business is called JB Performance and Reconditioning, and perhaps to be changed around the time or shortly thereafter when this episode is released. But he's got a really cool clinic. He's got some great educational, informative content. And our team actually was up there visiting, and they were super impressed by what they saw with you, Jared. So I'm really excited to dive in here, learn more about your practice and the methods, the techniques that you're using, and it's gonna be a fun one. So thanks for joining us.
Awesome. No, thanks for having me.
So can you talk a little bit about your background, your story, and how you came to open your own PT clinic, with this particular rotational athlete specialization?
I graduated from University of Indianapolis, 2015, with my DPT. I guess prior to that, played college baseball at Anderson University, a small D3 school in Indiana, and always kind of had that interest and passion for rotational sports. Upon graduating, I guess, from PT school, got into working for a local hospital outpatient clinic. I was there for about 5 years and saw a lot of your post-op, so your total knees, your fusions, shoulder replacements, just standard orthopedic injuries. And after doing that for about 5 years, when actually did one of my first supervisors encouraged me to take a TPI course, which stands for like Titleist Performance Institute. So kind of a getting me into like the golf specific side of things, and took that. About a year later, really kind of dove head first into that, and went down kind of their whole tracks in kind of the fitness and medical realm through kind of their different levels there, and really started to want to hone in and kind of specialize in that area. And at the end of 2019, made the decision to kind of step out on my own and start my own practice. So originally I rented space from a local gym here in town. And then after about a year and a half there, partnered with a golf facility called Touche Performance Golf here in Fort Wayne, to put my clinic inside of there. So basically at the facility now I'm at, we have 5 golf TrackMan bays. So TrackMan's kind of like a launch monitor simulator system. So guys can come in, practice, work on their games. That's giving all type of data and feedback on the swing. And so there's 5 bays. There's a guy here, Eric Touche, who owns that business. He builds and fits clubs for golfers. And then I have my side of it in the physical therapy and performance realm as well. So I have a space you can see in kind of the picture behind me. It's a little picture of the facility and the gym area. And then we have a separate treatment room for assessments and kind of hands-on treatments and stuff like that.
That's awesome. And I'm, of course, interested in the treatment of rotational athletes, which we'll talk about.
Yep.
Can you tell us a little bit on the business side, though, because we have many clinicians, many practice owners owning this. So can you talk to us about that? I would imagine that having a clinic, subleasing space like that is, perhaps less expensive, gives you more flexibility. Also, you have some sort of built-in referral sources. Can you talk about,
Sure.
that dynamic, sort of how you started that relationship and what that's been like, doing that
Sure.
sublease? Just, I think it's a cool kind of experience to share.
Yes. So it came about. So the facility I'm currently at, because yeah, at first, the first gym I rented from, I subleased from them as well. They had a treatment room, then I got full access to their facility, and everything was good there. But you'd have golfers come in, and they're like, okay, I'd set up a net in the gym, and guys would hit. We'd analyze some things with the swing, the body. But it's like you're using foam balls because once in a while a stray ball misses the net, and so you can't have that hitting somebody in the gym. And guys walk in, hey, am I at the right spot? And is this, you know, basically, there was a mutual client of mine, and then also of at Touche Golf, and basically he brought us together, and he's like, hey, I'd like kind of a one-stop shop for golfers to come to where you can work on your body, you can work on your swing, you can get your equipment, and basically have this one-stop shop of sorts where it's kind of an all-encompassing place to work on your golf game. And so anyways, it's really kind of that mutual client of both of our businesses that kind of connected us. And then once we kind of sat down and talked, it's like, mutually beneficial for both our businesses in the sense that, obviously a lot of the guys that golfers I'm working with, they're in need of clubs and equipment. So there's natural referrals there on that end of it. And then on the flip side of it, a lot of golfers coming in to get fit, for the latest clubs. And, I hear it all the time, like, guys getting a little older and you hear them in fittings and, hey, I've lost, 10 yards the last couple of years, or body's hurting, whatever, that you can tell there's a natural, a lot of needs in the golf industry for my service as well, for both health and performance. So, and then as you alluded to, being able to sublease, there's especially like being earlier on into the business, when I first moved in here, was definitely very beneficial to kind of help minimize some of the costs as well, and kind of, be conscious of that as well, for sure.
Mm-hmm. And is that something that you can be there? Do you have any other staff working with you currently, or you're still
Not yet,
the only
but they'll
practitioner?
probably have to be changing pretty quickly. So,
And you would still have room. Would you still have room there to add another staff clinician?
yes, yep, I think for sure there could be at least one other, and then, I think, again, I don't want to put words in their mouth at all, but I think there'd be ways we could be flexible with stuff at the current facility to accommodate that growth.
Awesome. All right, so let's talk brass tacks here. Rotational athletes. Is there that stands out in your mind of a few most common injuries that golfers come in to see you complaining of and for which they're seeking treatment?
Yes, definitely. So probably the most common ones, definitely, I mean, lower back, issue. I mean, a variety of lower back pain issues. That'd probably be number one. Wrist and elbow would be common as well. Some neck injuries, shoulder, hip related stuff. Those would probably be, the most common areas that I would deal with as far as golfers are concerned.
Okay, so since you mentioned that low back pain first, let's see if we can go about this as if we're sort of going chronologically through, which will give people an insight into your thought process and how you practice. So,
Yep.
so going through the TPI trainings that you've done and the other, schooling and training and experience that you have, how, assume a golfer comes in with low back pain. What does your assessment look like with them?
Sure. And yes, as you mentioned, like, I mean, TPI. So TPI, say they have those different levels, as I mentioned earlier. And the level one is basically looking at some of the common, physical requirements of the golf swing, right? Some of the common movement patterns. So it's looking at, hip mobility, thoracic spine mobility, as far as rotation, rotational capabilities in those areas, the capabilities of the pelvis, to kind of move, like, create separation, and kind of connect the upper and lower body, shoulder rotation, shoulder elevation, neck rotation, balance, core strength, those types of elements, right? And so for say, a golfer, they come in with low back pain. I will say I kind of see a wide range of golfers, and that I'd say the vast majority here in Indiana. I do have, a couple of professional golfers that will come in. but the majority are going to be, your amateur golfers, country club members. So these are guys that golf is not necessarily, they love to golf, but it's not necessarily their profession, right? And so with that, besides the golf swing, sometimes if somebody comes in, they could have, injured their back doing landscaping out at their house, So sometimes there are very golf specific reasons behind the back pain, and then other times, it's kind of differentiate. Okay, like what are the circumstances kind of behind the injury that kind of led to that pain in the first place, and then from there, kind of determine which route we need to go. Right. So in the case of like a golfer coming in saying, "Hey, I hurt my back golfing," or I've been dealing with this pain for years. And in a lot of cases, guys will just kind of, tolerate and play through stuff. But anyways, so say a golfer comes in, I may, likely start them with that first day. Say it's just general, trail side low back pain would kind of be the most common area. If somebody comes in with that, yes, we'll probably do a TPI level 1 screen, kind of looking at some of those characteristics. Depending on how severe and irritated they are, right? So if it's something that's really freshly inflamed, I'm probably not going to jump right into, hey, let's have you hit a ton of balls and look at this, right? Because it's probably just going to sort like things are already just too flared up to really get valuable information from that. But again, say it's something they're already playing with, I might then jump into like, okay, is the swing mechanics, besides just looking at the body and some of how they're moving there, are there any things from a swing mechanics standpoint that are contributing to that pain as well? Because there are certain kind of movement patterns and like mechanical characteristics that could be contributing to that pain, right? So we'll try and identify if there are any true things in the golf swing itself that could be causing the pain, and then connecting that with some of the movement patterns we'll see from the physical assessment side of it as well, and then kind of determining from there kind of what comes to the forefront as kind of the main things that we need to address.
So when you say trail side low back pain, that's if one is a right-handed golfer, that would be the right side.
Yep.
A left-handed golfer, that would be the left side, right?
Correct.
Just to make sure everyone understands that. So I like that combination that you're describing, looking at, the assessment. Do they have the requisite mobility in the hips and the thoracic spine, shoulders, etc.? And then you're also looking at the swing to connect the dots, because there might be, I guess I might be at risk of putting words in your mouth. Are you saying that, there might be a mobility deficit somewhere, but that may not necessarily be the thing that's
correct.
problematic in their swing?
Yeah, I think ideally, and so from like the movement assessment portion to also the swing assessment side of it is trying to identify, which of those impairments or limitations are truly driving the symptoms. So beyond just like looking at the body like globally and how it's moving in the golf swing, like there will still be some local assessment of the area that is, the injured spot to identify what exactly is going on. But then looking at globally from the body of determining, okay, what are some of the main drivers here for their pain, and then also why they're having pain in the golf swing specifically is as well with that. So in some cases, like you'll see somebody that, yes, some limitations could be strong. And this is where kind of the TPI philosophy comes in, is that some of these physical limitations like are strongly correlated with some swing characteristics. So for example, like if a golfer, say their hip rotation, so say a right-handed golfer, say their right hip doesn't internally rotate particularly well. One of the strong correlations with that would be something called like a sway, where they might tend to like slide their body more laterally versus rotationally. So that would be kind of what they call like a body swing connection, where the physical limitation could likely be contributing to that kind of swing or mechanical fault as well, right? It's kind of determining some of those connections. So in the, each of these cases, I think you're trying to identify, are they swinging a certain way because of an underlying physical limitation, or just because they don't know, how to move?
Everybody, sorry, we had a little technical challenge with internet connectivity, but we're back now. So Jared was talking about how there might be movement deficits that he would pick up on the assessment, and then how he's wanting to correlate those with swing mechanic, dysfunctions or different issues that may show up in the swing. So let's we can pick it back up on that thread of conversation here.
basically just trying to establish some of those relationships, and then from there, then use that to help the treatment based off
Okay. So let me ask this next question, and you can let me know if this is a good question or if you want to go in a different direction. But
that. Sure.
you had said when I asked you some of the more common things, low back pain jumped out
Yeah.
as being the most common specifically trail side low back pain. So, um, is it possible to say, applying the 80-20 principle, or is it possible to say like these are the top few things? Is it the hip rotation, thoracic rotation, or is it something else? Things that the top few things that you see that seem to be the biggest contributors to this most common most common complaint of low back pain.
Yeah. Yeah. So I kind of, yeah, some of the areas that you just kind of alluded to there. So yes, I would say, a lot of times, again, every case is kind of unique. I mean, in some, you will see it is just more kind of an isolated low back issue, but a lot of times in golf, with it being a whole body movement, that, I mean, actually, when you break it down as far as like what is physically, I think the most common misconception among a lot of, amateur golfers is that um, it's not as physically demanding as say if you're going to go out and play other sports like football or basketball or soccer. But the actual like range of motion and like physical requirements of what the body actually goes through in the golf swing and the speeds that it's doing it at can actually be quite demanding and stressful on the body, especially at the frequency at which a lot of guys are doing it through. You're playing 4 or 5 days a week, and in some cases, some of these guys are really not putting in much work on the body, right? And so with that, it can lend itself to certain things kind of breaking down or feeling some aches and pains. And definitely the low back is one of those. As you mentioned, yes, like a lot of times in those cases, seeing limitations in the hip, the thoracic spine, the shoulder, all those can kind of contribute to um, putting more, kind of stress and strain on the lower back. So, for example, like the lead hip. So lead hip, like internal rotation. So kind of being able to like clear your lead side and like downswing as you're trying to like finish the swing, right? Um, Say that is severely limited. A lot of times somebody with that limitation, they might kind of hang back on that trail side, or for a right-handed golfer on that right side. And with that, as you're kind of rotating, side bending, and if those forces are kind of backing up there, can just put a lot of compression onto the musculature and joints on that right side of the lower back. So yeah.
That's good. I
So
think.
yeah, so looking at I guess basically establishing, you know, again those areas kind of above and below the lower back. A lot of times are the ones where we'll find that's not necessarily that they're painful, but those will be kind of where the limitations are that could be putting more forward constraint on the lower back.
So, in other words, if the hip isn't rotating adequately, the
Yeah,
body's going to steal that or move that force onto the
correct.
low back.
Yeah, a lot of times, yeah, that will be a common presentation. So again, every case kind of unique, and some, that's not universal, but a lot of times there is, yes, definitely a relationship there between the two.
Okay. So following through this example, because I think it's cool to look at your framework along this continuum of assessment into treatment. So then, say there is a deficit in internal rotation in that lead hip. So in this
Yep.
case, right-handed golfer in the left hip.
Yep.
Uh, what are what's going to be your approach to restoring that? And I'm interested also
Sure.
just for background for people. Jared does use the Neubie in his practice, so
Yep.
he of course may talk about that at some point. And he also uses other technology that's cool and complementary to the Neubie, and that I'm excited to have him share because it also is effective and is complementary, and we want to know what's out there and what's working. So
Yes.
just with that preface, please go ahead.
Yep. So kind of along those lines, right? So like you said, I mean, the first part of the assessment is kind of like the big picture stuff, right? Trying to get like a global view of everything. And then say like, yeah, you find something with the hip or like an individual joint that you think might be driving some of those bigger global things, then it's kind of honing in and like doing some more local treatments on that. Um, which I will say, I think that's where kind of again, there's several applications, but like that's definitely one area where like the Neubie's kind of a natural fit is like once you've kind of done like bigger picture, kind of movement assessment, and then kind of identified some of those areas that might warrant like further examination. That's where like being able to scan, map the body and those tissues, and not just so say in the case of the lower back, you do find some of those issues with the hip. Being able to scan and map kind of those whole regions and be able to identify within that, okay, these are kind of some of the areas where there's tension, guarding, pain, whatever, and then be able to kind of hone in on that. And I think for a lot of people, right, when they'll feel some of that, because a lot of golfers like, okay, you're looking at my hip, but it's my low back that's bothering me. And then not that, they understand like there might be a limitation there, but then to actually feel, when you scan and map some of those areas and you find some of those hot spots, right? That might be areas that are away from like where they think the pain is, coming from, right? Now, not to say that there might not be a hot spot there, but just some of these, adjacent areas of the body where there might be some of that increased tone or guarding beyond just the source of the pain. So I think, yeah, there is, once you identify those, it's like, and that's where the TPI, as you kind of go down the track and utilizing, other educational things, I've done is just because you identify that stuff globally, you still don't know like why is the hip limited or where's this coming from and what you need to do treatment wise yet. So that's where like being able to kind of go down that pathway and kind of identify some of those specific, limitations and say like, okay, this is what I think it's, is it the hip joint? Is it certain soft tissue? Is it more nerve related? Like, why is that going on? And that's where I think the Neubie can kind of help in that kind of differentiation of, identifying whatever that source is and then being able to initiate treatment. So with that, I would say once you kind of, scan and map and use other techniques to identify, okay, this is what I want to do treatment wise. The Neubie also fits really well into being able to do treatment to that. I also have, other manual therapy certifications as well that, I will incorporate, some actually with the Neubie as well. So whether it's, soft tissue mobilization or with like the electric glove or dry needling or different, hands-on techniques there that could be with or without the Neubie, but basically using those to kind of restore those limitations, which I will say the Neubie, I think, can speed that process up and cause some pretty drastic gains and improvements in a relatively short period of time, where you can really get a lot of, I think, buy-in and really cool changes within a relatively short period of time within those sessions.
Awesome. So I want to return to this. Well, actually, first of all, one comment, which is I appreciate how you connected the dots there, where a patient with low back pain might be concerned that you're not listening to them if they say my back hurts, but you're working on my hip.
Yes.
But if you find a hot spot on or around the hip, that helps them viscerally feel that, oh, there is an issue there and it's worth working on. I think
And
that was a
sometimes,
great.
it might be beyond what they even feel in the lower back. And they're like, oh, wow, maybe, yeah, there is something. Like, why the heck am I feeling that? And, oh, wow, like it makes them kind of a little more receptive once you start like, hey, this is what I think's going on. This is where I like think we need to initially go with our treatment plan. And you get some of those reactions where, like, as you're scanning and mapping, like, why does it hurt there? That's not necessarily where I thought my pain's coming from, but yet I'm feeling it more intensely in these other areas. And then I think that gets them more receptive to like once we do that, and then seeing how that in turn changes sometimes their movement and then how the lower back feels, and they're like, oh wow, like that's kind of changes their perspective and like thought process, about their injury or pain.
Yeah, that was a great insight. So I want to continue to follow along this, but I want to take a short
Yeah.
tangent here
Yep.
to talk about. So there's a little bit of controversy in the biomechanics world
Yes.
about this definition of internal and external rotation in the front hip. So
Sure.
So that just quick summary for you listening to this. There's, if you're a right-handed golfer, when you swing and you follow through and your weight goes into the left leg,
Yeah.
it feels like, and many people think that left hip is internally rotating, but there's a strong biomechanical argument that it's actually external rotation and
Yeah.
that the internal rotators are just working eccentrically to limit that.
Sure. Yes.
So, so where I know I can tell you're aware of this, sort of quasi controversy here. What's your take on the definition? And ultimately, it may not matter clinically, but it is. I hear people argue this adamantly, so it is an interesting point of discussion. What's your take on this whole scenario?
So if you had asked me this like 3 years ago, I probably would have fell in the first definition because that would be it, like by the TPI definition, right? Or would be kind of the first version you said is basically that left hip, right? As you're turning in the downswing, that would be internal rotation into the left side, right? And that would kind of be how, like I said, TPI would kind of define some of that, which I understand where some of that's coming from. And like I said, initially I probably would have like very much so agreed with that. It's interesting, and probably even since like incorporating the Neubie, where I could definitely see the argument for like the eccentric piece of it of the internal rotators, because a lot of times that's where, as I'm scanning and mapping some of those spots, that's where, I'll find some of that. A lot of hot spots, areas where there's guardian then, and, with treating that, I'll see, significant improvement in, that how TPI would define as internal rotation, right? So I can see both ends of it. I would probably at the moment say I shift maybe a little more towards like the eccentric piece of those internal rotators than like biomechanically just the internal rotation of the hip joint, so to speak. Does that make sense?
Yeah, it's so interesting. I sort of, having thought about this as well, have concluded that it probably is it is an external rotation movement on that entire side of the body
Correct.
skeletally,
Yes.
but at the same time, increasing internal rotation range of motion allows you to get further over there. So there must be a component of that as well. So
I think so. Yeah. Like, I mean, I can truly, I mean, I hate to like play both sides of the fence, but I think, yeah, there's like some truth to like both perspectives on that a little bit, because yeah, it's like I have seen clinically, like as internal rotation improves there, that I do see better better clearing of mechanics with that.
yeah,
But I also appreciate, yes, that other perspective of how that hip musculature and the internal rotators are working through that as well, and it being more of kind of like an external moment. I mean, throughout the body in that downswing and finish. So I could kind of see, yes, a little bit of yeah, both perspectives as far as that's
yeah.
concerned.
And if anyone listening to this is wondering what we're talking about, at least I was exposed to this. I believe this line of thinking comes from PRI,
Correct. Yep.
and at
Yes.
least that's where. So, and the idea being that when you rotate onto that back leg, you're externally rotating everything. You have external rotation, flexion,
Yep.
and then you also then as you push off, you have extension paired with internal rotation
Yep.
of that back leg, and then you shift the weight and you accept it on an externally rotated side
Yep.
there, and um, that so there's this interesting, like, you can look at it from different angles and they both kind of make sense at the same time.
Correct. Yeah, that's a good way of putting it. That yes, I can see, and like clinically, I've seen both sides of it as well. So it is, yes, a very yes, interesting topic. And like I said, I because yes, I've seen both camps, um, and have seen both clinically, but yeah, good question.
All right, so let's go back into this hypothetical golfer that you're treating who has right-sided, trailing side, low back pain. You found a deficit in lead hip or left hip internal rotation. You talked about how using the Neubie would be one of the tools there, because especially if there is any neuromuscular guarding and
Yep.
inhibition, you can help them activate there.
Yep.
If it's more uh, hardware, less software, or more bony structure. You're using some more manual techniques.
Correct. Yes. Yep. So that's where, yeah, some of the other manual therapy, techniques that I'll utilize. So yes, I would say that's, again, yeah, the Neubie is definitely a good like piece. But yeah, they're, like I said, that's why as you're examining some of that, trying to determine, okay, what is the underlying reason for, this limitation. And then from there, once you kind of have a good sense of where that's coming from, then you can kind of help direct on which interventions would probably be the most appropriate.
Okay. So then once you do some intervention to improve that local range of motion, what's the strategy for then reincorporating that back into the global movement? And if we're
For
skipping any
sure.
steps along
No,
the way that you want to elaborate on, of course,
no,
elaborate
I
too.
think
But
that's perfect. So, um, I think along those lines, and that's where, and even if it is, say more of a, hip joint issue or something, like I found even incorporating, the Nubia, some of that has been very beneficial as far as, the neuromuscular rehabilitation, just kind of getting the whole system, with some of the motor learning and kind of reprogramming of some of those movement patterns that you're trying to, because that's the thing, right? In the golf swing, I think a lot of times people assume like, okay, now just because my hip has this improved, capability, that automatically it's just gonna translate into my swing. But a lot of times, it's these are deficits and impairments that guys have dealt with for long periods of time. And so there is a, motor learning process of how to, integrate that and feel what that should actually be like, right? And so one of the things I've, in the clinic, that I found really effective for kind of helping bridge that gap is something called Rotex Motion, which was designed by Dr. Joe Lacaze. He was former Navy SEAL and then went to chiropractic school, and really brilliant guy. But he developed this product called Rotex, and it is one of the best things I've found for, for anyone, but also like especially rotational athletes, as far as really being able to feel, what, whether it's the hip, the spine, the shoulder, putting them in very functional positions as their, um, yeah, functional positions relative to their sport that they're going to have to get into. That is both training both the mobility and stability piece of those. So, like for the hip, there's some very specific things to kind of work on that internal external rotation capability in a way that's extremely functional to how it's going to work in the golf swing.
so what does the Rotex
So
look
it's
like?
it's
That's
kind of
like
like
the thing that you stand on.
so yeah, it's kind of like so it's a little disc. Okay, well, platform. So maybe I don't know the exact dimensions, but there's basically this rotating disc on the center of this little platform. Okay, and so within that disc will rotate, right? But there's a little resistance built into that. And so for imagine like, okay, like somebody, say you just worked on their hip, you're gonna try and reinforce some stuff and kind of re-educate them. They basically stand on the center of this disc, okay, which then will rotate with them as they move. But the real magic happens as so say they rotate back like they would in a golf swing. And once they're kind of in that end range position, then they will rotate that foot back inward, which then is kind of isometrically like stabilizing the joint and the muscles in that position, and kind of connecting the body to that kind of new range of motion, right? And giving them some of that control there. So does that make some sense?
Yeah, I think so. I'm actually just pulled up the website too to see it. I think I had
Yep.
seen it before, perhaps on your Instagram page or
Sure.
something. But
Yep.
uh, it looks cool, and the fact that you've had a good experience with it, of course, has me more intrigued by it. I've never personally used it, but I'm interested. So
And like I said, it's cool. I mean, I'll concurrently, I'll do that. Once I find some of those hot spots, like we'll do that concurrently. Like some of the exercises and reinforcements there as they're also like hooked up, to the newbie going through stuff. So a lot of times we'll get kind of combine, both of those together as we're working through stuff.
So it's a tool for training. I mean, well, actually, I'll back up even a moment. So
Yeah.
when we have the newbie on, we want to be doing relevant movements to teach the patient, client, athlete to start incorporating these muscles into those movement patterns. And
Yeah.
so this is a tool that can be used during training there, and it basically allows you to have really targeted rotational movement patterns. Is
Yeah.
that a fair?
Yep. I mean, there's uses beyond that, but yeah, definitely for any rotational athletes out there, yeah, there's a ton of applications and very specific to how the body's going to function, in their sporting movement for sure.
Cool. All right. Well, perhaps you listening to this are reacting similarly to me, thinking, "Oh, that's interesting. I'm going to try that." So I'm going to be on the
Yeah,
website
so
and
I'd say, I
either
mean,
find.
obviously, before I had that, like, there were other ways you could, go about addressing that. But I would say in clinic, um, that's been by far, yeah, one of the most effective I've seen it kind of bridging that gap in that area there. So that's definitely one, yeah, I would say really good success with like the rotational athletes I work with. Obviously, there's other techniques and things out there, but I think the ability to currently kind of work on multiple things in a way that's real specific to their sport. So like, once you get off of there, it gives a good connection to then being able to make that very transferable to what they're trying to do, in their swing, which is probably, one of the things I really just like about it.
Mm-hmm. That's awesome. So, all right. So that's part of then the process of once you've looked globally, big picture, then you've gone locally to look at, in this example, hip rotation in a hip joint, and then you're using then Neubie and Rotex to go back globally to incorporate that new range of motion. So they learn the motor control patterns, they learn how to incorporate that
Yeah.
into
And
the.
within that, like even with the Rotex or other stuff, right? I mean, you could still do beyond just like, okay, before, like you could do more kind of local oriented stuff with that as well before you bring it to like a golf specific,
Mm.
movement pattern as well. So some of it just depend like, okay, like, yeah, I might initially do something more locally based and then transition that into something more functional and transferable to like their sport specific stuff.
Okay. And then in terms of either return to play progressions or other techniques or technologies that you use, in this sort of hypothetical example, what are any other remaining pieces that you emphasize or would want to focus on to get this golfer back onto the course, at peak
Yeah.
health and performance?
Yeah. So within that, so you can see a few things in like the picture behind me, but tried to have like a variety of pieces of equipment, not just for the sake of like technology, but stuff that would be very transferable or beneficial for rotational athletes and some of the demands for their sports. So one of the things would be something called Proteus motion. That's basically you can see a little bit in the background there. Basically, it's uh, this machine that's basically works in kind of 360 degrees, right? So it's working in kind of all planes of motion. Um, and basically, that arm of the machine will kind of move whichever direction I want it to. So within that, it kind of lends itself to being able to load some areas of the body in the way that traditionally, with barbells, dumbbells, kettlebells, that might be a little more challenging to load in other planes of motion that rotational athletes kind of need to function in some of the transverse and frontal plane. And so the Proteus has been really effective at being able to train in kind of all planes of motion, and especially that transverse plane. So a lot of rotational stuff. Within that, the machine can also break down kind of various muscle groups and movement patterns where it's identifying, your differences in strength, power, acceleration for different movement patterns and muscle groups. So say you have somebody coming back and there's, a big difference in say, rotational power strength, on your right side versus your left side or vice versa. Like it will identify any, big discrepancies or imbalances in the body. So just because somebody might be, pain free, there might be, if somebody has a huge deficit in, certain areas of the body, it might be putting them at an increased risk, right, for re-injury, when they're going back out on the course. So I think it's good for both being able to identify some of those, warning signs, but also like for performance gains as well. It can identify stuff, from, because most of those movement patterns you're testing should be things that kind of correlate to speed, distance, performance on the golf course. So it can also, from a performance standpoint, identify any energy leaks in the system as well.
That's awesome. I've gotten to use, not regularly, but at least to try out the Proteus, and I've really enjoyed that too. And I got connected with Sam as the founder. Do you know Sam?
Yeah. Yep. Correct.
He's they got a really cool thing going, so
Absolutely.
might be worth having him on the podcast at some
Yes.
point too.
So that's been great. Not to get off on a tangent too much with that, but one of the things as well. So, again, I'll kind of deal with both like the performance and rehab end of the spectrum. So, we'll use the Neubie on some of the lower frequencies. So we'll do like, some different priming stuff, activations, like before hitting balls or practicing or doing like a speed session. So we'll use some of those different settings in, conjunction with some of the technology at the facility to really get some really cool gains along some of those things as well. So that's been, again, not rehab related, but that'd be like something further down the road where, a lot of guys like speed, distance, power, like those are definitely things in the golf world. Guys are always trying to chase a little bit more of those. And so being able to combine the Neubie, like I was utilizing those pieces of equipment before, but combining the Neubie alongside that has led, I've seen some really cool, interesting cases with that as well. But not to get too far, I know we're kind of rehab side, but just wanted to put that out there that there are applications with some of this stuff beyond just the rehab side of it that's also good for performance as well. So
Yeah, I love that, and I want to get to the performance side. Just one quick.
Yep.
I don't know how quick it'll be, but one more topic.
Yes.
While we're on the rehab side, before we transition over, you also work a lot with baseball players.
Yep.
Of course, in baseball, there's throwing. So I imagine if in terms of differences, you do a lot more, see a lot more shoulder injuries or have to do a lot more arm care,
Yes.
rehab,
Yep.
etc. Are there any sort of major differences in treating and training and caring for golfers compared to baseball players?
Yeah, I mean, obviously, yeah, there are going to be some differences there for sure. However, with that being said, like as far as how the body's like sequencing and like transferring energy and stuff rotationally, there are a lot of actually similarities between the two as well from the ground up, how the body's sequencing and coordinating some of that. So while there, yes, are obviously unique differences between the pitching, motion and a golf swing, there are actually some commonalities as well between the two. However, like from like an injury standpoint, like you said, somebody comes in with an elbow injury, I'd say similar to the case we gave of like, the hypothetical low back pain in a golfer. Similar, a baseball player coming in with like an elbow injury. A lot of times it's looking beyond just the location. I mean, obviously there can be an isolated elbow issue, but looking beyond that at the shoulder complex, the thoracic spine, the hips, like how the whole system's functioning and how that may be contributing to increased stress and overload on those tissues of the elbow, right? So I think, again, that's similar concepts from like a movement assessment along with some of like the local assessment to differentiate like, okay, it's just a local issue? Is it an overuse thing? Was it a workload issue that led to this? Is it something mechanically? And then within those mechanics, was it, certain areas of the body that might be energy leaks or areas of dysfunction that could be causing increased workload elsewhere, such as the elbow or shoulder? So within that, I think, yeah, there's some kind of common elements as far as the assessment process and rationale of looking both globally and locally, just to make sure, because like I said, you could have, a pitcher that take a few weeks off. You think you've calmed the area down, but if you haven't looked at some of the bigger picture stuff and some of those other areas that might be contributing to it, as soon as they get back on the mound, if those aren't addressed, you might be getting missing something, and then they get back out there and, they're back in the, treatment room needing, just kind of spinning their tires, going back through all that.
Mm-hmm. Okay, so that same framework that we've talked about, we certainly can apply there, and that all makes sense. I would like to transition, as you already started to segue into, more performance, and I want to talk about swing speed,
Yep.
which of course you also mentioned, leads to increased distance, etc. So there's a few components that go into, creating force in an athletic environment. There's there's strength. When you're more max strength is when you're lifting something heavier and moving slower. More high speed when you have something light like a baseball, and you have more speed, so you don't have to create as much force, but you have to have greater speed of movement. Then there's speed strength in between, where you have a combination of relatively high forces at a relatively high speed.
Yep.
And then there's different qualities, like there's concentric strength, there's rate of force development,
Yep.
or acceleration or explosive strength, and then there's elasticity, and then there's also a little bit of a difference. In golf, you take a full windup, whereas in baseball, you sort of start back and you don't get as much of that elastic
Correct.
recoil.
Yes.
So let's talk different. Let's talk first about golf. If someone wants to increase their swing speed, I think a lot of people think, oh, I need to go in the gym and get big and strong. But oftentimes when we lift weights to get quote unquote stronger, that doesn't actually increase speed, because if you think about like a power lifter who can lift 1,000 pounds, they're not going to be the fastest athlete. They're going to be able to do a lot of force, but it's slow. So we got to be more speed oriented. But can you talk about the sort of the traits that go into creating speed in the golf swing and how one can effectively train those? Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Neubie can impact your life, please visit our website at www.neu.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there.
So yeah, swing speed and golf, I mean, that's something pretty much every golfer looking for more speed, more distance. Along those lines, as far as what goes into it, as you alluded to, I mean, you could kind of go down a rabbit. There's, a lot of different things that could kind of contribute to that. As you kind of mentioned, several of the physical aspects of, speed, strength, power, acceleration, rate of force development. All those various elements obviously play to some degree in the creation of club head speed. However, I would say, alongside that, right, the tricky part, and same thing with like, say a pitching delivery, is that the swing mechanics side of it is also a big piece of it as well, right? So there's obviously a blend of the two. I will see some guys that may be, very physically gifted in those areas. Yet you watch them swing and it's not there because they can't transfer that into, convert that into the appropriate sequencing and timing needed to produce speed in a golf swing. Because it's different than, just like, a vertical jump or, somebody going to dunk it. Like there's more, the mechanics of it, there's more moving parts. And so within that, being able to sequence and time it all makes it a little trickier than just saying, hey, X physical thing automatically guarantees that you're going to swing X amount. Like there's the potential to do it, but doesn't necessarily automatically mean a golfer will do that, right? So that's where it's, yes, looking at, and there's technology, force plates, 3D motion capture to see how well they are kind of able to sequence and do some of those things. And then alongside that, as you mentioned, obviously, you could have the best sequencing, timing, all that in the world. But if you don't possess those physical qualities that underlie that, the ball, you're not going to generate the speed either, right? So it is kind of that blend between the two of efficient mechanics combined with those physical characteristics you mentioned there. So with that, as I'm working with or assessing a golfer, and this is where technology such as the Proteus, like it can look at those things for relative areas of the body, right? As far as speed, power creation, speed, acceleration, in those kind of movement patterns that are going to be correlative to the golf swing, or pitching, throwing, any of that stuff. But yeah, looking within that of seeing, okay, does somebody possess those things? And if they do, TPI, like others have been able to get pretty close to estimating, like, okay, in theory, this would be what you're capable of swinging, your club speed, your ball speed. This would be your physical potential. And then if somebody has a gap there, then you can kind of help identify, like, okay, this is probably going to be more mechanical, focused and getting more efficient with your mechanics and better there. Or, what, things look pretty sound there, but we need more on the physical end of it as well, right? And then also making sure it's stuff that is going to be stuff that's probably transferable to the golf swing versus, like you said, again, nothing against strength or like powerlifting, because you do have to have a requisite, foundation of strength there for sure. But there comes a point of diminishing returns, right? Where some of that stuff, if you're at a 400-pound bench going up to 450, probably not going to move the needle as much in, the realm of like generating speed in a golf swing. Because like you said, the golf club, relatively speaking, is going to be relatively light, right?
Yeah.
So within that, I think a lot of guys, especially on the amateur side, I'll see of it, especially as they get older, quit training some of those other characteristics you mentioned, such as power, speed, acceleration, rate of force development. They might be in the gym doing other stuff, but then they don't really address those other areas. And so with that, that's also something as we age that starts to drop off pretty drastically. And so if we're not addressing some of that stuff, you might be missing the boat on some of the training as far as getting, max transferability into, club head speed and ball speed.
So, some strength is still important, enough strength is still important because you're still putting force into the ground. And you said that.
Correct. Yeah. So yeah, there definitely needs to be, again, like, and that's some, where some are very, I guess, afraid of, the weight room that way, that it would, they're going to get tight or stiff and which isn't true, but like there is some, there's kind of fears on both sides, right? There's some that will be, very hesitant to begin, resistance training that way, even though it's going to be the thing they need to kind of develop that appropriate foundation. And then once that's there, like there's others, okay, like we kind of check that box to a degree, like, relative to whatever your goal is. So like knowing that that's not the low hanging fruit that's going to be the limiting factor. And now we probably need to shift gears and kind of go down a different track to pursue some of those other characteristics needed as well, right? So getting that balance where, yes, all those things to some degree are important. It's just determining for each person, like, where at on that spectrum are they and what probably needs to be the primary focus.
Yeah, it's like saying just because drinking too much water occasionally kills someone due to hyponatremia, or diluting too much their sodium concentrations, doesn't mean that you shouldn't drink any water, right? There's still a good, just because a few people occasionally have done too much strength training, it doesn't mean that you shouldn't do any, right? You need to find
very, very
right
rare
now.
will there be too many golfers that at least that I've seen, that overdo like too much. Now I have one guy right now, and he didn't do too much. It was just, like he's somebody that, 400 plus pound bench press, 600 plus pounds squat. Well beyond what the amateur golfer like I typically see, right? And for him, it's just like, okay, like I'm trying to get to, I'm at 110 club head speed. I want to get to 120. Well, I'm like, okay, obviously further strength in those areas probably isn't going to be where we're going to need to spend the majority of our time, right? So for him, there were definitely some things with mobility and just, part of it, he hadn't done much in these other planes of motion besides the sagittal plane. So getting his body a little more accustomed to developing some of that proficiency in those other planes of motion, getting some mobility training, and then a lot of other stuff along those lines that you said, acceleration, power, speed oriented training to be able to use that force quickly, right? And so I think, for each person they're coming in for an assessment, it's trying to identify that stuff. So then, from there, hopefully you can be a little more accurate and, okay, like precise in what we're going to focus on training wise to get, there as quickly as possible. And then if they check off those boxes, then be able to shift gears and, go the appropriate route.
And I think this is essentially agreeing exactly with what you just said, and I think there's a good framework, at least that I sort of keep in my mind. I can't remember where I first learned this years ago, but, some athletes are sort of more strength oriented and need more, elastic reactive work. And then some are more reactive oriented and need more just strength work, to sort of balance that out.
Absolutely. And so I think that's where, some of the tools like, because I'd say, a lot of the guys, a lot of people, right, they'll read, the internet, social media, like, there's tons of information out there, right? And so there's, hey, I watched this 30-second clip on, this is what I need to generate club head speed, or, this is the secret sauce. And it's like, well, but is it appropriate? Is it the right thing for you at that time and place? And trying to match those up to where that person's at that moment. And so
Mhm.
I think everybody's different, and so that's why you have one person comes in and their program may look completely different than the next relative to their goal, and then kind of where they're at from a physical standpoint as well.
Yeah, that makes sense. One thing that you mentioned during this last segment on swing speed and performance too that was fascinating. I love that idea of being able to tell based on certain attributes what someone's maximum potential for swing speed is, or distance, and
Yeah,
then knowing from there if they're not able to reach that, then there's a leak somewhere. So that
correct.
I love that. Can you elaborate on that a little bit more?
Yeah, so this is where TPI kind of started this concept. So they were started this with kind of various power tests, so including vertical jumps and medicine ball testing, and they have access to the top professionals in the world, thousands upon thousands of golfers that they came out and tested, and they've seen all this data. Okay, they've accumulated large pools of data over the years, and so they were able to identify some of these correlations. Okay, like among these tests, these are where we're seeing guys that they achieve these results here. These are kind of the outputs they're putting in speed, ball speed, and club speed, and identified some pretty strong relationships there where they can come within a couple miles an hour of predicting somebody's ball speed based off of some of those tests, right? And I would say Proteus, they kind of came in and took this to the next level, being able to look at both power, acceleration, speed in some areas, beyond a little more specifically than what those TPI tests were, initially. But so I'll still use some combination because the TPI tests are, fairly easy to learn and like understand. Proteus, the first time you do it, you do kind of have to understand how the arm works and kind of get a feel for some of that, especially some of the rotational movements. I mean, once you get the hang of it, then it's fine. But that first time, you're naturally going to, if you came back and tested 24 hours later, you'll get a boost just because you're better at performing the test, not necessarily because you actually gained anything physically, right? So I think once somebody gets those, then, similarly, like Proteus has also accumulated a large sample of data, so you can differentiate and sample all that, or sort all that out by age, whether they're playing collegiately, professionally, men, women, and club head speed, all those things, and be able to identify, like, okay, here's where I rank within these characteristics. Here's where I'm trying to get to. And so within that, like using some of those data pools and sample sizes and being able to, from that information, let somebody know, like, hey, these are areas, like whatever your goal is, this falls within that, this falls below it, this is above it. And then from there, being able to tell them what's the appropriate course of action to get to where they want to go. Right. And so
Yeah.
I think, with all those things there, it might be something where, like, hey, you need to see a swing coach to work on, X, Y, or maybe I'm not the best person to address that component of it. Maybe you need to see another, somebody else to, uh, train that component. So it could be more swing oriented stuff, beyond what, I would do. Cause I'm not a, swing coach. We'll do some stuff speed training wise, but if it's something, some of those mechanical elements specifically, that's where collaborating with, golf professionals that way can be very helpful, for golfers as well. Kind of having a team approach, that's kind of all encompassing.
Awesome. I love that. If I were in Fort Wayne, Indiana, and enthusiastic about golf, I would come in and work with you. I absolutely,
That's
and
right.
baseball too. But
Yep.
that's awesome. I really appreciate that. So as we wind down here, of course, want to let people know your website and social media where they
Yep.
can find you. But first, let me ask you, if you could put a billboard in Fort Wayne or Indianapolis or anywhere where it's going to just reach the most people, or any message you could shout from the rooftops, what's the one message you could share if you had one billboard worth of characters?
Yep. So I would say for definitely for the golfers, just the concept of better with age. That I see a lot of guys that are 56. I mean, my oldest client that I work with currently is 86, and he's, I mean, I have several cases of guys, in their 70s that are better than they were in their 60s or their 50s, right? And so mean, so many times you just hear the excuse like, oh, I'm just, I'm 10 years older, not like just throwing in the towel. And I think whether it's the newbie or any of this stuff, like there's so much capability to get better, even though you might be older, like it doesn't need to just be like a death sentence where like, okay, this is just the new normal, this is the way it is. Like there's actually a lot of things you can do to either, I mean, in my opinion, improve, let alone maintain those characteristics. But I've seen, yeah, numerous, I mean, success stories of guys that are way better now than they were 10 years ago. But it's just a shift in the mindset of like, yeah, like it's possible. Like you just don't have to accept these things as just the new norm and status quo.
I absolutely love that. That was pure gold. Could not agree more. I want to highlight, underscore, italicize, bold that. Totally agreed. It's not, when we say it's because of age, it's not just the passage of time. It's what we do at that time.
Correct. Correct.
Yes.
And I will say this, that I think, again, the newbie's been a good, instrumental piece of, because I think there's some things that, I mean, people can, depending again on what the issue is, but the right, person appropriate for it, I mean, you can get some like drastic changes and things where guys like, man, I haven't moved like that. I mean, I had an 80-year-old guy. We scanned and mapped some things. He had some back pain, but then beyond that, like he's like, oh, I just want, like he responded to all that. So hey, let's try this out. And we did something, and like he went down and like touched his toes, like, and he's like, I haven't done that since I was in high school. Like, what the heck was that? And it's just within like one session. He's like, well, what else can we do? Then it just kind of opens the door on like, oh, what worked for this? We're like, what are all the other possibilities that we can do with this? I think, yeah, just as encouraging to see people like just shift their, mindset and perspective on all that stuff. Like, oh man, like there is a whole new world that, the possibilities out there beyond just like, oh shoot, like I'm just going to be confined and just, gradually decline. And that's just it. So,
yeah, beautiful, beautiful. So as we wrap up here, what's the best place for people to, if they want to come to your practice, tell us your website, follow along with you, tell us, social media, all that stuff, best places to keep up with you and your work.
So website would be jaredbicklept.com. Although that might change with a few rebranding things. So, but at the moment, that would be the website. Social media would be Jared Bickle DPT at Instagram or Facebook. But I'm more active on Instagram than Facebook. So either one of those, and then if I do happen to change the website, like I'll update that on the social handles as well, so that would reflect there. So
awesome, and he's got great information on Instagram. Definitely worth a follow, especially if you're as interested as I am, and you might be in rotational athletes and this stuff that we've talked about here today. So Jared, thank you so much for coming on, for the work that you're doing. You've obviously really invested the time and energy to become a real leader and work towards mastery in your craft. I respect that, admire your work, and I'm honored to be able to collaborate with you and have you be a wonderful part of NeuFit Nation. It's amazing. So I appreciate you coming on. Thank you so much.
Yep. Thanks for having me.
All right. And thank you for tuning into this episode. We will see you next time on the Undercurrent podcast.